Hello everyone, I'm Dr. Krystosik and I'd like to welcome you to the first episode of the Doctor of the Future. This is a brand new podcast. It's born today to teach you how to unleash the healing power of your body without drugs or surgery. Doctor of the Future is a gathering place for thought leaders who are changing the face of medicine as we currently know it. The visionaries who are going to be on this program, on this podcast, are timeless. This actually is an age-old branch of healthcare, but right now, today, during our current times, it's being renewed and transformed into a modern and robust science-based system. It's called many different names, like functional medicine and lifestyle medicine and natural medicine and complementary medicine, integrated medicine, alternative medicine, on and on and on. There's a lot of names for it, folks. But no matter what you call it, it has some basic tenets that make it distinct and different from the way modern medicine, or basically conventional medicine, is currently being practiced. Now, here on this podcast, we're going to refer to this new branch, this old new branch of healthcare as functional medicine. That's we're going to keep it. We're going to keep things simple. But first and foremost, this healthcare system believes in the healing power of nature. In other words, the body has the power to heal itself, folks. And this system that we're going to be talking about, functional medicine, always seeks to cooperate with nature. Can't fool Mother Nature. And number one, it talks about food as the best medicine. You know, the body has the power to heal itself. And I like to make an analogy because Einstein said that we only use 10% of the capacity of the human mind. And I believe that conventional medicine is only using about 10% of the capacity of the body to heal itself. Functional medicine, on the other hand, recruits that other 90% of the body to heal itself. And it unleashes that healing power inside the body. Now, folks, right now, there's a healthcare revolution that's taking place in our country, actually around the world. There's actually a rebirthing of the ancient traditions of healing from around the world, and many of these healing traditions now are being renewed and revised. Then they're being refreshed, and science is now uncovering how these healing systems, how they affect our bodies, how they work, and how they heal our bodies. So in concert with the old ways of the traditions of people from around the world, I'm talking about the ancient Chinese, the ancient Egyptians, the ancient Greeks, the people from the Mediterranean, the people from around the world, from India, you know, who have many traditions of healing. We're looking at uncovering these on this program, but looking at it with a new twist, with new insights. And the new discoveries that are being made every single day by science to create this very robust, evidence-based healthcare system we call functional medicine. It uses food as medicine. It cooperates with nature. You know, but before we get started, I really want to make it very clear that here on the Doctor of the Future, we are not against using medications or surgery. No, that's not what this is all about. We're not opposed to using medications or surgery. It's the overuse and the unnecessary use of medications and surgery that we're opposed to. You see, conventional medicine, with its drugs and surgery, and its armamentarium, and its whole milieu of things that it uses, is a blessing and a curse at the same time. First, it's a blessing when it comes to using emergency medical care. We have the best emergency medical care system in the world, hands down. But at the same time, it's a curse when it tries to take everyday common illnesses, especially chronic illnesses, and try to apply emergency medical model to the chronic diseases that people have. You know, I'm talking about diabetes and heart disease and Alzheimer's disease and, you know, chronic digestive disturbances and autoimmune disease. When conventional medicine tries to apply that emergency medicine model to those type of chronic diseases, it's failing miserably. You see, conventional medicine looks at all illness as having a single underlying cause, and disease is a result of some kind of invader, to the body, a bacteria, something, that is trying to overtake the body. And so what medicine tries to do is try to overtake the body and use drugs or surgery and interrupt biochemical pathways in the body, or do surgical procedures overtaking the body. On the other hand, functional medicine is entirely different. It tries to cooperate with the body. It tries to go with inside the body to unleash the power the body has to heal itself. The body knows how to heal itself. It already knows how to do that. You see, and as a result of conventional medicine using the drugs and surgery, it limits the long-term positive outcomes that drugs and surgery and technology alone can provide. Because again, we're not doing very well when it comes to chronic disease at all. We'll talk a little bit more about that. But functional medicine, again, relies on the healing power of nature. And it goes back into that old world thinking, because this is not new. The Greeks knew about this power of the body to heal itself. They called it vis medicatrix naturae. Naturae, the healing power of nature. And this is really a paradigm shift from the way medicine is practiced over the last 100 years. There's a transformation taking place, and it's growing exponentially. People everywhere are becoming quite concerned about the dangers of modern medicine. And quite frankly, people are catching on to the fact that conventional medicine only treats symptoms. It doesn't get to the cause of disease. And as a result, we have an epidemic of chronic diseases here in this country. Again, hands down, bar none, conventional medicine is the best when it comes to emergency medicine. But we need a new model. And that's where functional medicine comes in. And here on this podcast, The Doctor of the Future, it's not about having doctors on with a lot of degrees like PhDs or MDs or DCs or NDs or DOs or nurses or whoever's in the healthcare field who have a lot of degrees and a lot of education. It's not just simply about that. And that's good. There's nothing wrong with that. Because many of my guests from around the world that we'll be interviewing on this program have these credentials. But it's also about these people using common sense in cooperation with nature and backed up by science. That's the conversion of all those three coming together helps the body to heal itself. And that's what we're talking about. It's not about just advancing more technology. We already have the most advanced technological society in the world. In our medicine field, we have all kinds of advanced technologies. We have the most expensive healthcare system in the world. But we're spending more money than any society, whether it's the nations that are undeveloped or even nations that are developed nations. We have the most expensive healthcare system in the world. We're spending up to about 17% of our gross domestic product on healthcare, but we have a dismal 50% of our population has at least one chronic disease. 50% have at least one chronic disease. 25% of our population has more than two or more chronic diseases. And listen to this, the World Health Organization has done a ranking of the healthiest populations in the world, the healthiest cultures, the healthiest nations. And we used to be number one here in the United States. We used to be number one in health and healthcare. Today in the world, we rank 37th in the world of the nations around the world. We're just above communist Cuba, folks. Something is wrong with our healthcare system. We all know that. And so it's the job of the physician, of the doctor of the future, to teach each one of us how to use the power of the body to heal itself, to cooperate with nature, to use food as medicine, to use the knowledge that we have about genetics and biochemical pathways in the body and about lifestyle to help our bodies to heal itself. And it's our obligation to teach others about how to do that. You know, the word doctor has a Latin root, which the word literally is called docere, means to teach. A doctor is supposed to be a teacher. We're supposed to be teaching others how to live an independently healthy life. You know, my journey as a doctor started back in the early 1970s on a farm in Hiram, Ohio, an organic farm, where a bunch of my hippie friends and I would gather around a meeting room in a farmhouse in Hiram, around there, right next to the college. And one of the professors there, Al Couch, was a leading expert at the time, helping to teach us how to respect the soil around the earth and the food that we receive from the soil. Soil, food, and health. That's what he called his classes. And that's where I began my journey. And as it evolved and as I grew over time, I learned about the healing power of nature. And I learned for myself firsthand how the body can heal itself. And I learned from my friends and others. And we grew as a community and we learned about natural medicine. And that was the roots that I had. And then I've watched this movement, this natural healthcare movement, grow exponentially over time, whereas initially it was looked at as really nonsense. Back in the early 70s, natural medicine was looked as nonsense by the scientists, by the conventional doctors. But now today we are seeing a revolution take place, and we are seeing mainstream medicine starting to embrace natural medicine. We've come a long way. And you know, I learned with my friends back in the early 1970s that there was already a growing epidemic of chronic disease, and that having more doctors and more technology wasn't going to solve the problems. It wasn't going to get us healthier as a nation. We realized that we needed each one of us to take personal responsibility for our own health, and things have not changed. We need to take actions to take care of our health. We didn't need more doctors. We don't need more doctors. There never is going to be enough doctors to take care of all the people who don't know how to take care of themselves, or even worse yet, refuse to take care of themselves when they even have the knowledge. The answer is to teach people how to unleash the healing power of the body by cooperating with nature and using the principles of functional medicine. That's why I'm excited about this whole movement, because it's growing and it's gotten so big that the whole resistance that occurred back in the 70s is dying out, and it's being overtaken by this desire by people to learn about natural medicine. You know, just remember this: no matter how many degrees your doctor has, it's you, the patient, that determines the outcome of your health. The value of your next doctor's appointment is $0. It's $0 if you don't end up in the doctor's office that employs functional medicine. And if you don't end up in the functional medicine doctor's office, your visit's going to have zero value if you don't take action. If you have zero action, your value of the next doctor visit is going to have zero value. You know, Thomas Edison, he was a visionary, and he brought us many things. He was an inventor, he was a businessman. He brought us the light and light bulbs so we could see the world better. He discovered how to record and play back sound and record things on even a motion picture camera. He also provided us with the ability to sustain life within our environment. He had some environmental things that he tried to employ. But we've not embraced his vision for future healthcare yet, although we are moving in that direction. And here's his quote, a very famous quote from Thomas Edison. This is what he said: This is what a visionary he was. He said, the doctor of the future will give no medicine, but will interest his patients in the care of the human frame and in diet and in the cause and prevention of disease. The Doctor of the Future podcast is built on the foundation of Thomas Edison's famous quote. And you know, one of the things that most people never read about is in that quote, he also said, you cannot improve on nature. You can never improve on nature. That's what Thomas Edison said. This is something that we embrace here. The transformation in healthcare as we know it today, the new model of healthcare, which is basically built on an old model, the ancient traditions from around the world, the Ayurvedic medicine and the medicine from the ancient Greeks and the ancient Chinese and the populations from around the world, the Mediterranean. It's built on these models of illness, is basically a result of our lifestyle. Medicine's reliance on drugs and surgery has a place, but it's not the answer for our chronic diseases. We have an epidemic of these chronic diseases, and the emergency room procedures are not going to cure our chronic diseases. You taking responsibility and working with a functional medicine practitioner and learning ways that you can empower yourself to overcome illness by embracing the natural approach to health and learning ways to empower your body, to unleash your body's power to heal itself. That's the way you're going to overcome illness. And you will learn from these visionaries on this podcast of how to do that. That's why I'm excited. This paradigm shift, this shift and this model shift, it's an entirely different model. It's an entirely different way of looking at disease is going to give you the ability to put back health into your life. This systems-based approach is going to help you to restore your health if you lost it and to maintain your health into a ripe old age so you can become independently healthy. That's what this program is all about. That's what this podcast is here for, to teach you how to do that. I'm excited about looking forward to the guests that we're going to be having. You know, coming up in the second or the third podcast, we're going to have Dr. Alessio Fasano on the podcast. He is another visionary that is a current practitioner, much like Dr. Gallen, who's going to be on today. Dr. Alessio Fasano is the hero of the leaky gut. And he is the world's authority on celiac disease and gluten sensitivity. And he's going to be on this podcast. So tell your family and friends about this. We're looking forward to this next podcast and the future podcasts coming up. We're going to have leaders, thought leaders from around the world on this podcast teaching you how to be able to recruit the healing power of nature to help to restore your body to health and to live a long life. Again, it's a system-based approach to healthcare, bringing all your systems of your body back together so that your body can heal itself. You know, empowering patients into a therapeutic partnership with the doctor and a patient-centered, evidence-based, clinically based, evidence-based, and experience-based of the doctor coming together. That's when we talk about evidence-based. Evidence-based is not just about science. Yeah, that's a part of it. But it's also the clinical experience of the doctors, because the doctor's clinical experience creates a lot of value. And so in this model, as opposed to the medical model, which says there's only one cause of disease, it could be bacteria or some kind of an invader in the body. In the model that we're looking at, one condition can have many causes. Well, let me give you an example. Let's take a look at irritable bowel, for example. A person with irritable bowel can have many different reasons why they have irritable bowel. So you could have 10 people with irritable bowel, and they also have a different reason why they have contracted irritable bowel. One person may have food allergies, hidden food allergies, what we call delayed food allergies. Another person may be lactose intolerant. Another person may have chronic stress that they're not dealing with that's triggering their symptoms or maybe complicating their symptoms. Another person may be taking medication causing their irritable bowel syndrome. Some people are on the 10 to 15 different medications. Not uncommon today, folks. Not uncommon. Still, another person may have a genetic glitch in their ability to be able to break down simple sugars. So they end up with irritable bowel because they don't know it, because that genetic weakness they have, nobody's ever uncovered it. That's what functional medicine does, though. Another person may have what we call SIBO, small intestinal bacterial overgrowth. It's bacteria growing in the small intestine. It's an overgrowth, and shouldn't be any bacteria or very little bacteria in the small intestine. Another person may have a yeast overgrowth, overgrowth of yeast inside the intestinal tract. Another person may have a lack of digestive enzymes. There's a lot of reasons. There could be a structural misalignment in the spine. There are some people who have a structural misalignment in the spine who have chronic history of constipation or diarrhea, or what we call irritable bowel. I've seen it in my practice. I've seen it firsthand. It's not often, but it does happen. So this functional medicine model, it's individualized approach. It has to do with genetics and the biochemical pathways in the body and lifestyle factors. And in functional medicine, we use specific tools to identify the cause. And then these tools, we have tools to treat the cause, the underlying cause. So I want to encourage you to take part in the Doctor of the Future and learn from these thought leaders. And I want you to understand something. You are a doctor of the future as well. I don't want you to miss out on that point, because Hippocrates, father of medicine, said, "Physician, heal thyself." You're not going to hear that very often from doctors that you go to typically. But Hippocrates, the hero of modern medicine, which they're not really paying attention to a lot of things he said, like "physician, heal thyself," or "food is your best medicine." That was another thing Hippocrates said. But you're going to hear about that kind of stuff here on this program. So I encourage you to tell your family and friends and loved ones about the Doctor of the Future, where we are going to provide you with the tools, with the knowledge. We're here to educate, not to medicate. We want you to understand that it should always be natural medicine first and drugs and surgery last. That is our goal for you. We want you to live independently healthy, and we're going to teach you how to do that. Now, today, we're going to dig into a discussion I had with Dr. Gallen. He is a visionary, a doctor of the future, and he's going to explain today in part one of the 4-part series on COVID-19. He's going to explain, as he does so well, as he says in the podcast today, that COVID-19 is not some terrible monster that we've never seen before. He explains very, very articulately that it's a virus, and humans have been exposed to viruses for thousands of years, folks. But here's the difference. Dr. Gallen explains it very well. The difference is we have the convergence of 2 distinct factors that are happening today, that we end up having this current healthcare crisis that it's unbearable for most people, and it's creating so much fear in people's minds because of 2 factors. Number one, viruses are becoming more virulent, stronger, tougher for us to deal with as they adapt. Becoming tougher, folks, becoming more virulent. And number 2, our immune system is becoming weaker because of poor diet, environmental toxins, stress, and multiple other factors that most doctors are not addressing. But the Doctor of the Future podcast will address these things and teach you how to be able to correct and be able to overcome these stressors in our life and to remove them. Folks, the viruses are becoming stronger. Our immune system is becoming weaker. This is a perfect storm. It's a perfect storm. And that's how the viruses are overtaking people's body, because the general population has a weak immune system and the viruses are becoming stronger. So today we're going to begin by digging into Dr. Gallen's explanation of how COVID-19 is able to invade our bodies and how it's able to cause so much harm inside of our bodies, even to death. Death to our loved ones and our families and friends. But more importantly, we're going to understand through the Dr. Gallen's explanations how COVID-19 invades the body, and you're going to learn how to protect your body from this invasion. You can protect your body from being invaded by this invisible killer by using food, lifestyle, so you could have a protective shield around your body. And beyond that, if you contract the virus, Dr. Gallen is going to get into teaching you some things that you can use to overcome this illness, to help your body to combat the invisible killer on its own. Your body has the capacity to be able to overcome this on its own, folks. You're just not taking advantage of that today, and we're going to teach you how to do that. So right now, let's dig in. Let's get right into part one of COVID-19, the tale of 3 enzymes with Dr. Gallen. Today, we're delighted to have a pioneer and a brilliant global leader in the burgeoning field of natural medicine, functional medicine. He's one of those people that walks into a lecture hall, into a room for people learning about health, and you're immediately drawn to his words of wisdom. He's one of those few doctors left in the country that he's not afraid to stand up for truth, folks, no matter what the cost. He's an author of over 40 peer-reviewed research journals, research papers, as well as numerous articles in well-respected health journals. He's an author of several books and New York Times bestsellers, including Fat Resistance Diet, The Heartburn and Indigestion Solution, Power Healing, Super Immunity for Kids, and the Allergy Solution that he wrote with his son. So, Dr. Gallen, welcome to the program.
It's good to be speaking with you today.
Good. Well, I'll tell you, you have done so much, and I want to say right up front that we are so thankful for your contribution to the world of natural health and functional medicine. It's just been a real blessing to watch you over the years and what you've done and the contributions you've made.
Okay, well, there have been a lot of good people whom I've interacted with over the years, and I've learned a lot from my patients because they have been very cooperative.
Well, one of the things I wanted to say is it's really amazing how you have contributed to so much, including the Leaky Gut Syndrome, and you've been a leader in that, and you're almost like one of the fathers of that whole movement in the leaky gut. I mean, it's pretty amazing. And people who don't know about leaky gut, it's a term that in the medical community is called increased intestinal permeability, but we and just common folks were talking about it as leaky gut. And thank you for your contribution with that, by the way.
Well, that's an area that I've been interested in for about 35 years, along with the microbiome in the gut, even before there was a term microbiome, because gut microbes and intestinal permeability have a really profound effect on systemic health. Mm-hmm. And they also impact in a significant way the effect of nutrition on health.
Yeah.
Because after all, what you're feeding yourself, you're also feeding your microbiome.
Yes, yeah. Okay, so Dr. Gallen, I know you're a big proponent of the preventative medicine, and that's what we are all about here on the Doctor of the Future. And so many people are looking for recommendations on what to do about COVID. And I was listening to Dr. Burke, And she said on national TV, I think that in this country, we're taking a very liberal approach to the mortality rate in COVID-19. I wanted you to make a comment on that.
Well, I'm not sure what she meant by a liberal approach,
Well,
but
news media outlets are saying that there's a lot of inconsistent counting methods and of the deaths of coronavirus, and including death rates from heart attacks and strokes, and so other illnesses are included in that. I just wanted to see what your thoughts about how they document that.
Well, first of all, the clearest data on the fatality rate, and there are two types of fatality rates. When we talk about death rates, there's the infection fatality rate, which is of all the people that get infected, what percentage die? And then there's the case fatality rate, which is of all the people that present themselves with a clinical illness, what percentage die? Now, the clearest data probably comes from the Diamond Princess cruise ship, because that's a closed community, and everyone on that ship, over 3,500 people, was tested by the Japanese government, and 706 people became infected, 9 people died. So that's a case fatality rate of 1.4%. That is significantly higher than, let's say, the seasonal flu, for which the case fatality rate is 0.1%. However, all of the deaths on the cruise ship occurred in people who were over the age of 70. Interestingly, though, systemic illness was even more likely in the young adults than in the older adults. So there are a lot of paradoxes in the way that this disease presents itself, and in the outcome. And there's a lot of data that we don't have. Recent studies looking at what's probably the frequency or prevalence of infection in different communities has indicated that there are at least 10 times as many cases as have been suspected. And so the case fatality rate or the infection fatality rate may be lower. It may be as low as 0.5% or even below that. It depends on what community you're looking at. And one thing about the case fatality rates and the infection fatality rates, they're going to vary with the population that you're studying. It may be less on the USS Theodore Roosevelt when all that data is compiled, because those are mostly young seamen. Whereas on the Diamond Princess cruise ship, there are a lot of older people who are on a cruise. So I don't think we know. What I will say about this virus that is really important, and I think these are the critical aspects of trying to understand this pandemic, is that, number one, this is not a ferocious monster that destroys everything in its path. Half the people that get infected have no symptoms at all, and of the other half, 80% have a kind of minor or trivial illness that doesn't necessarily require medical care. But 5% of that 50%, or maybe 2.5% of the total, develop a catastrophic disease that is unique and different from what we've seen with the flu, for example. So they present into hospitals and they're really sick, and you treat them as if they have the flu. That doesn't work, because they have a very distinct kind of biological problem that I think can be anticipated and well understood from what we know about the biology of the virus, but that information has not really been put into clinical play, as far as I can tell. Now, the secret that this virus has, and the reason that it's created a worldwide standstill, is that it spreads very rapidly from person to person. It's probably 4 or 5 times as contagious as the flu. And because it spreads so rapidly, and so many people are asymptomatic, it spreads very quickly, and that creates a lot of fear and concern because
Well, the thing that I'm concerned, the thing that I'm interested in, and I understand, and that's well said, but there's a lot of conflicting information out there, and I wanted to see if you could set the record straight, because some people say, well, they're over counting, the documentation is not, it's skewed. So I just wanted to see your opinion, if you thought it was skewed or it wasn't.
well, the initial documentation was skewed, and everybody could tell that. That is, if all you do is look at the people who present themselves to hospitals because they're sick, which is the way the original Chinese data came across, yeah, you're gonna get a case fatality rate that's 3 to 5%, which is what we've been seeing. No way is that the true case fatality or infection fatality rate of this virus. If you take the data from that's accumulating, and the thing is, it changes all the time. But I'd like to run a little math just to give you an idea of how hard it is to kind of wrap this up. Let's say that the case fatality rate is 1%, which is what Anthony Fauci was saying 2 or 3 weeks ago. It's less than the Diamond Princess case fatality rate, and it's probably greater than the actual rate. But 1% is an easy number to work with. And it takes about a month or so from the time you get infected until death. That's pretty clear. So right now there are about 50,000 people who have died with COVID-19 in the U.S., maybe a little bit lower, a little bit higher than that. Most people say it's a little higher, but we'll accept 50,000. Those 50,000 people come from a pool of 5 million people if you have a 1% case fatality rate. But that's not 5 million people who have the infection now. That's 5 million people who had the infection in the middle of March when we had no idea, when we just thought there were a couple of thousand cases in the U.S. So looking, and if the case fatality rate is lower, let's say it's 0.5%, not 1%, then that was 10 million people that were infected in mid-March with this virus in order to produce the 50,000 deaths that have occurred. So I think that this virus, I think what we can say is this virus is very widespread and has been spreading under the radar for 3 months at least. And it just moves very quickly from person to person. I think the goal should be to help people stay in that 90% that doesn't really require medical care or get sick. And there are a number of steps that I think can contribute to that.
We're going to get into talking about that, but talking about that 80 to 90% of people who get mild symptoms, which is about 80%, right? That get mild symptoms.
80% in the Chinese study.
Okay, so I know that's in the phase 1 that is of the illness, and I know you're like a big proponent of trying to expand that 80% to maybe 90%. That'd be great if we could do that. And the thing about it is that once somebody's gotten into that illness, the virus, you've developed some pretty amazing strategies on all your research that you've done to help to minimize the symptoms or help people get out of that quickly. So I'd like to have you talk a little bit about that and the phase 1 and what you recommend.
order for the virus to attach to ACE2, it first has to have its own surface proteins altered. And this is, I think, some of the most exciting recent research explaining how this virus came to create a pandemic. There's an enzyme, which is also a human enzyme, called furin, F-U-R-I-N, that is expressed on the outside of cells and around cells in very low concentrations. But furin is needed for the proteins on the outside of the virus to be altered so they can lock into ACE2. And genetic research that's looked at what's happened with this coronavirus and compared it to other coronaviruses has led to the conclusion, this is not everyone's conclusion, but certainly mine when I look at this research, that a series of mutations in the surface proteins of the virus increased the sensitivity to furin, allowing it to attach to ACE2, lock in very tight, kind of like a key that's jamming into a lock that's it's not perfect for the lock, but you can't pull it out. And that is responsible for its high rate of infectivity and virulence. So two strategies that are amenable to nutritional preventive approaches are to find ways to support ACE2 activity and to block furin. The third enzyme is an enzyme that is produced inside your cells by the virus, kind of taking over your cellular machinery. And this is something that's called the main protease because it breaks down protein, also known as the 3CL protease.
Okay, I am glad you joined us today, and I hope you are as excited as I am, folks, about the information Dr. Gallen has brought us today. And I'm looking forward to, as I hope you are, to hearing the other three parts that my interview with Dr. Gallen has to offer you to be able to overcome that fear of COVID-19. I want you to be able to overcome that fear and unleash the fighting power your body has to combat this virus. This is what the Doctor of the Future is all about. We're here each week to bring you health tips, a lot of different health tips from the greatest minds in functional medicine, in natural medicine, drugless medicine, from around the world. We're here to teach you, to educate you, to avoid unnecessary medication and enable you to live this independently healthy life that I've been talking about, to live a drug-free, vibrant life into a ripe old age. So, until next Saturday, where we're going to bring you another episode of the Doctor of the Future, I want to encourage you to take charge of your health. Use the food on your plate for both enjoyment and as medicine. And do all that you can to think right, eat right, and to move right into a lifetime of good health. So until next week, when we meet the next Doctor of the Future at the crossroads of personal choices and the future of you and your loved one's health, I'm Dr. Krystosik, aka Dr. J. Here's to your health.